This is hopefully going to be interactive. There's going to be a lot of photographs here on things that I've had the privilege to experience with some of the patients I look after. And to give you a bit of a background of where this is coming from, it's interesting that we're on Peter Morand Crescent. Does anybody know who Peter Morand was?
Yeah.
Exactly. Exactly. There you go. And my first degree was in chemistry, so I know Peter. There you go. So Ottawa, so Peter Morand Crescent, that's interesting. So, and I also was interested, somebody said Wakefield before. So when I first went into medical school, I was wanted to be a family doc in Wakefield. And so Peter Lemley, I think, used to be a part of the department here, and lots of connections. And for different reasons, I did family medicine for about 4 years and then decided to do physiatry because of all the chronic pain that you guys see in family medicine, and thought that residency might teach me to deal with this a bit more astutely. And yet I found after 5 years, I still didn't feel like I'd gained a whole lot of ground. So God love you for being the ones that keep getting these patients back when we send them back to you and say, I don't know what to do anymore. So in the midst of this, I've put together a talk when I was asked to give a talk on resiliency. It's not actually one that I usually give. Usually it's on chronic pain and these amazing expeditions I've had the privilege to go on. So when I concocted, I thought, well, what better forum to look at resiliency through the lens that our patients provide us, and that we can maybe get inspired through our patients, even though somebody was saying, as we all do, we look at a list and then some days are better than others. Some patients we love more than others, and so maybe we can see it through their view and gain resiliency as opposed to having that erode our resiliency. So you get a lot of nice photographs of some expeditions I've been on with the True Patriot Love Foundation, which is an organization that raises funds for injured soldiers. If ever you're interested, they've got a website and there's all kinds of interesting stuff there. So I get support for research through the Surgeon General Science and Technology Fund, but no other grants or speakers honoraria. I'm an expedition physician, as I mentioned, since 2012, and I've been to Nepal, the North Pole, Antarctica, and to Kilimanjaro. And I'm a volunteer for Project Trauma Support, which is in Perth, actually. I used to moonlight in Perth in the emergency department, and there's a physician there, Dr. Joannou. Does anyone know Manuela Joannou in Perth? You do? Did you train with her, or did you? Brilliant. In Perth, yeah. Oh, God love you. That's yes. And so it's just an hour away from Ottawa, but that hour in the back of an ambulance, I must say that's the scariest nights I've ever spent was in that emergency department. 1 year rotating internship, and you've got a baby with meconium aspiration, newborn, and you're it, and a mom, baby, and you 1 year. It seems criminal by today's standards, and that's why I kind of got cold feet and left family medicine. But so, God love you who do primary care in rural settings. So Dr. Joannou runs a program called Project Trauma Support for first responders, veterans, military, and it's phenomenal. I never would have believed in 1,000 years that 6 days of a residential program could change someone's life just by changing the way they see things. And you're probably not going to believe me when I say this, because after 30 years in practice, literally it's 30 years this year that I graduated from Ottawa U, I've never seen anything as effective as this. So if you have first responders that are struggling with PTSD, that have been through the gamut of traditional and non-traditional therapies, this is one thing to consider. And we all do it on a volunteer basis, so there's no plug in that. So there's mitigating potential bias. I do feel very strongly about what I see when I'm on these expeditions, and this first-hand experience will obviously taint my perception of things. And I feel like a bit of a hypocrite, because I feel like I have the best job around, in the sense that after many years of being in the trenches, I've got a bit of time now to step back and look at the bigger picture and be able to do things like this afternoon, give you guys a lecture. So this is all the stuff that you've already got on your outline. I'm going to skip right ahead because this is what we're all here. I'm going to divide this up in 3 nice, tidy parts. One, what is resiliency? Give you some examples of people that have demonstrated resiliency, and then how you might be able to incorporate some things into your day-to-day practice to foster your own resiliency and that of your residents. And please interject. What I tell people when I give these talks is, please call BS on me if there's something you say that just doesn't work in my practice, or that's all nice in theoretical terms, but that's not going to work for me, because I do realize that a lot of this might be pie in the sky, and yet I've seen it work, so you'll have to trust me on that one. So this is a picture in Nepal, and today if you show that to the Children's Aid Society in Canada, they might consider these parents somewhat neglectful, right? So this one child looks like she's about 4, maybe her little brother's 3, and this still young girl here is about 1.5, maybe 2. And so is that neglect, or is that breeding resiliency, right? And I think maybe somebody mentioned before, I was really intrigued with the discussion, maybe this is where resiliency starts. And as a parent of 5 children in a reconstituted family, I can tell you the pendular swings from my parents that came from post-World War II Germany, and where, my God, it was literally very, very strong discipline, to then suddenly saying, we're going to make something different. It'll be easier for them. I'm not sure we did our kids a favor. And all three of my kids biologically have some anxiety disorders, which seem to be rampant these days. So, and if you have a recipe for that, please, I'd love to talk to you afterwards. So the definition of resiliency. So straight out of Wikipedia, this is what resiliency is defined as. So I'll save you the hassle of walking through it and just summarize the main points. So successfully cope with a crisis, promoting personal assets. I think this is really important that we see this as a stimulus to promote personal assets. Potential negative effects of stressors. So again, it's potential, not necessarily that every stressor is negative. Allow you to remain calm in the situation that you're in without long-term negative consequences. And then you'll see later, I'll say that even you'd say with positive long-term consequences, because I think stress can have, in the proper setting, the proper dose, positive consequences, and an evolutionary advantage that most people have. So the fact is, we were hardwired for resiliency, otherwise we wouldn't be here. So this is a fish that came floating up. Had anybody seen this before? That came floating up at the lake at the cottage a couple of summers ago, and obviously bit off more than he could chew, right? And I thought this is a kind of a good metaphor, because sometimes you may be feeling like this fish, and sometimes you might be feeling like this fish, right? On the days where your clinic list is very, very long, but obviously there is a limit to how resilient you think you might be, right? So I'm not saying that we can all go biting off bigger and bigger chunks. There is a limit to how much you can do. So here's where I might deviate a little bit and sort of amalgamate the talk on post-traumatic stress, in that, is medical training, or should medical training involve some element of trauma? And I put that out there in all sincerity, because it certainly was for me. And I can tell you numerous accounts that in hindsight would have been considered abusive and probably would have been reported to the college and so forth. But I can't say today that that harmed me. You know, in fact, I'll give you one example where it haunted me for 30 years. You know, it's 6 o'clock in the morning, you get called up to the surgical station, and the surgeon is reaming you out for having let his patient go a little bit dry that night. So 30 cc's an hour, you know, I figured that was reasonable urine output. And he's just in front of the resident, the medical student, and the nursing staff just completely reaming you out without any kind of reserve. And you walk away with your tail between your legs, and you think, my God, I'm useless. I'm almost quit medical school, and you think I'm done. Fast forward 30 years later, so I'm having a beer with a good surgical resident who's now in the military, and tell him this story. He says, you know, this has been haunting me for 30 years that I let that patient run dry that night. And he says, no, that's what we do now. We like to keep people a bit dry, because when they're too wet post-op, they tend to ooze through their wounds, right? So first of all, you don't know the end of the story. So when something traumatizes you for 30 years, or when something in your education, you know, has left you shaken, we don't know the end of the story. So I'd only leave you with that. So I think medical education can be traumatic. Should it be? We could argue. I don't think we should spare people from the realities, because sooner or later they're going to be in the trenches as you are, and they're going to feel the brunt of practicing day to day. So how do we define injury from trauma? So as an MSK physician, I look at adaptability from a bones and joint perspective. And you can adapt to almost any load, as you know when you go to the gym, as long as you do it incrementally, right? So the resulting clinical outcome of a mismatch between tissue load and that tissue's capacity to adapt. So it's purely a question of adaptation, whether or not we become resilient. So either the load is too high, acute or chronic, so very good points before about starting on internal medicine, that's too high in acute load, or the tissue's ability to adapt is compromised acutely or over time. So people have either an acute severe overload, or they've just burnt out because over time there was too much. So this is a case of overloaded in the 6,000 meter Himalayan mountains, and somebody with high altitude pulmonary edema, a nurse who had not acclimatized despite our best efforts. And if you look at the literature on acclimatization, if you go to Kilimanjaro, if you take a 7-day trek versus a 5-day trek, your chances of success are much higher. And 10 days, you're basically almost guaranteed. So again, the incremental load is where things are at. Sources of stress. I don't need to really rehash. This is just the first thing that came off of my thoughts. So it never seems to be enough. How many of you feel that? Whatever I do, it never seems to be enough, right? But there you go. But I'll ask you later, where does that come from? Because I mentioned a lot of stuff about childhood, and we'll talk about that later. Why does it never seem to be enough? And who's putting that onus on us? Yes, the system will take as much as you can give and then spit you out again. Doc Internet, that was mentioned as well. Time, resources, patient expectations, old wounds. Again, my staff always say I've got a fetish for old wounds because after 30 years in practice, I'm thinking this is where the money is. And if you can heal old wounds, basically you can get through almost anything in life. And then basically you can fill in the blanks. So my wife keeps reminding me, change the way you look at things and the things you look at change. So what do you think when you see this guy? Why? Anybody done this before? No? You think it's crazy? So does he look like he's suffering? No. He's at peace. Yeah. What if this was your CEO of your local hospital said, we're going to be doing a team building exercise now and everybody's going to get hooked on this meat hook here? A bit different connotation, right? But if you went on a Buddhist Zen meditation retreat and said, this is part of me feeling like I'm centered, it would be a completely different connotation. So it's not so much the stimulus. And assuming he's wired like the rest of us, his pain signals to his brain are the same as for you and I. But the attenuation is, those downward inhibitory nociceptive control systems that we all have that we can capitalize on through meditation and various other forms are probably firing full cylinders here. Whereas depending on the context, this could be excruciatingly painful, right? What's that saying? Here you go. So you got that pretty quick, right? So your brain, again, is hardwired. What was the first thing? I heard Stephen Hawking's was the first thing that people caught. Is that what got your attention? That's what got mine when I saw this on a T-shirt on some guy's shirt in the train, is that once you saw Stephen Hawking's, then you said, well, I got to think outside the box. And then then you start seeing that differently. So again, we're hardwired to adapt to change. So Charles Darwin, the survival of the fittest, we always mistake that as survival of the strongest. And I think in North America, we've kind of really lauded that survival of the fittest attitude to a false expectation degree. And it's not the survival of the strongest, it's those that are most capable to adapt. So the fact is the world is ever changing, and right now no more than ever before. And our needs to adapt are becoming stressed over and over again. But we do have the capacity to adapt, I would argue, to almost any situation. The issue of social media came up a few times in the previous talk. I suspect my personal bias is that social media is inhibiting us in a lot of ways to allow ourselves the time to adapt. And it's a distraction from the real issues. So I'll show you a small video snippet. Hopefully it works, and hopefully the sound works.
You're about to meet Michael. He lives fast as a self-made millionaire.
You didn't have to dress up, it's alright.
You're going to photograph Michael. He's actually saved somebody's life. Michael is an ex-inmate. He's a commercial fisherman. Michael aims on the site.
Nice to meet you.
Michael's a former alcoholic. Here's your camera. I'd like you to flesh out the essence of who he is.
What would you like the photograph to say about you?
Find it being psychic impacts much on your day-to-day life.
I can see this is a emotional point.
Likes to get to know the person. You've only got 10 minutes, right?
I think you're a guy that's putting stuff out there. You're not hiding anything. My plan was to find out about whoever it was and to try and get that. And what I learned from him is he's incredibly brave.
It's really intense. The shit. It's very...
I wanted to see the nature of the person, which then present the challenge. How do you portray him as a solution?
That's perfect. He's a self-made millionaire, sort of a little bit intimidating, but I wasn't going for a beautiful, nice, perfectly lit portrait.
I just want to try and bring out something of who you are. I think that we just treat you like the everyday people like everybody is. Pleasure. Thank you so much.
Well, I hope I've got that guy's bravery on film.
So it was a very intimidating environment.
I like the empty chair. It's good too.
So it's like 6 different people. So not everything I told these guys is true. You're not a fisherman. I I'm not an alcoholic. The GFC hit me hard, but I've never been a millionaire. Never been in prison. I am a blonde, I might say, but the story we talked about never did. Not psychic. Can barely spell it.
Before I knew there were different character pieces, I thought, that's really strange. These don't look like portraits of the character I thought you were. You always got your own preconceptions and got your own ideas.
It pushed me into a position and Thyself wouldn't be.
You have to dig a lot deeper. It needs to be, I think, a lot more creative to work out how you want to play things.
All right. Oops. Just close that one. Don't want to watch that one. All right. Oh. How do I get back? Sorry, I'm not a very good computer geek here. Just turn that one off. There you go. Perfect. There we go. Thanks. All right. So, again, I think that shows us that the lens through which we see the world is much more important than actually what we see. And I can tell you for a fact, most of the patients that I'm seeing have seen some pretty horrific things. And as horrific as those things are, and I'm sure you've had your share of stories, it's not always just the nature of what we've seen that's important, but the stories we tell ourselves about what we've seen. And particularly when we tell those stories over and over and over again. And all of you have played the telephone game in kindergarten, right, where you pass along the message. So what happens to that message once it's gone through a few years? It's markedly distorted, right? So I think our stories that we tell ourselves get distorted the more often we repeat them. And we should be very cautious and be critical of the things, the stories we tell ourselves. So what can contribute to resiliency? There's a whole bunch of things, but physical training, mental training, attitudes, beliefs, previous experience and judgments, how we view the world and our roles in it, which is critical. And again, as I said, change the way you look at things, and the things you look at change. Anybody seen the movie series, What the Bleep Do We Know? It's a brilliant series if you want to look it up. So Einstein, as you know, looked at light and said, is light a particle or is it a wave? Remember from physics? It's both, right? It depends how you look at it. And the experiment that you construct to see what you want to see determines what you see, right? There's also a Japanese photographer, if you look, who's done pictures of ice crystals in different containers. And this is really far-fetched, and I won't blame you if you walk out after I say this, but the ice crystals' morphology changed based on what was written on the glass. So in other words, I love you, thank you, I appreciate you, or I hate you, I want to kill you. The cells or the ice crystals in the container that said, I hate you, I want to kill you, were actually in disarray. So think about that for a second when we're having negative thoughts of what's happening at our cellular level, right? And as you'll see later, there's a whole bunch of ways where health is impacted by what we think. And not to quote Woody Allen, but Woody Allen was once quoted saying, I don't get angry, I just grow a tumor instead. Right? And that's classically, be careful what you're thinking, your cells are listening. And there's a lot of evidence that. So these people that you meet along the trail don't complain, they're joyous, they've got loads on their back that you and I would have a hard time carrying just for a few feet, let alone all the way up this mountain. So basic training principles, how do we become resilient? Who's ever fractured a bone here? Have you ever refractured through the same site? So generally that fracture site's stronger than the rest of the bone, right? Now this is a pathologic fracture, but you're not usually going to fracture through a site. So Wolff's Law, you remember from orthopedics, right? We mend stronger in the broken places. So what we've created, I think, is a society that's averse to being broken, to having experience that may lead us to think we're broken, but without the notion that that might make us mend much stronger. So this is in Lukla in Nepal, which is the most dangerous airport in the world, or probably one of the most dangerous. So the takeoff's not too bad because it's a short takeoff And if you look here, this runway basically ends, and so the plane kind of flops off the end. And if you look at the tire marks in the grass as it's going off, there's some tire marks that go quite a ways down. So some of those planes are pretty overloaded. Even scarier is when you're coming in on the other side, because you've got to bank around this mountain and then come in, and there's a rock face right where the photograph is taken. And so you're committed, right? Basically, there's no way out. If you get here and say, oh, that's it, I need to bail, you can't. Right? So commitment is a big thing, and I'll show this photograph at the end just to incite you to commit to something, some change. And I got married last summer, and to be honest, my wife kept saying, let's get married, it'll change everything. And I've been through that once before, not to rehash my own stuff, but look, the paper doesn't change anything. That's not going to change anything of how we interact today. Well, you know what? It does. It does. The commitment does change something. So if you commit to something and stay the course and just show up, right? The residents that are calling in sick, if you can say, look, I know you're going to have bad days or good days. I don't expect you to be a rock star every day. Just show up. I was told that early on. Just show up. Unless you got some infectious virus, that's going to go around the clinic, just show up, right? Preferably on time, but just show up. So some examples of resiliency, and I'll go through a few of these. All these people have given me permission to show their photographs. And this is all physical trauma, but most of them have their share of mental health issues as well. So this is, anybody know Master Corporal Jody Middick? He's a city councillor in Ottawa. He lost both legs in Afghanistan, and Corporal Andrew Nisley, who lost his leg, actually a hip disarticulation, who did the Targa race in Newfoundland. I think they came in second. So the reason I show you this is, A, it's a road to recovery. None of us are ever there. So if you ever think you're going to get there, you'll be fit, you'll be resilient, you're going to be whomever, whatever, you're never there. And that's not the point. Just like the summit in mountain climbing is not the point. It's the road up there. And it's a bumpy road, and it takes you around some wicked bends sometimes. But one thing you can see, they're not looking into the rearview mirror here. In fact, they're full straight ahead, and they know where they're going. So the biggest challenge, I think, for a lot of people, and rightfully so, our generation pretty much was guaranteed if you work hard, you study, you're going to get a job, right? But as was mentioned before, that's not always the case for the people that are succeeding us. Who's familiar with the ICF model? This is a World Health Organization. This is sort of a classic physiatry Bible model. And I'll just walk you through this very quickly just to show you why we sometimes fail in our mission helping patients, right? So this is where we focus most of our attention. Although family medicine, I would suspect you guys really cover more than most specialties. But generally, we look at body structure and function, physical or psychological impairments that limit participation. But this is where real life happens, right? So this is being a good father, a good husband, wife, worker, resident, whatever it is. And we make the assumption that if we just fix this, then this will happen by itself, right? How often have you ever heard when the patient comes in, I got a sore knee, and they say, well, what's happening? Well, I'm waiting for the orthopod. Well, when's that going to happen? In about a year and a half. Okay, what's he going to do? Well, he'll probably scope me and I'll be good to go and get back in. And what's wrong with that model, right? It's very utopian. In that 1 year and a half, there could be a lot of stuff happening that is going to help that person reintegrate. And so what I propose to you is participation, showing up, being there is the key to healing this, right? And there's many, many examples I'll show you where that's the case. So in other words, setting the bar higher than you ever thought possible, and not labeling yourself as having a severe generalized anxiety disorder or depression, but getting out there and showing up, right? Now, obviously, environmental factors and personal factors play a huge role. And this is something one of my students did for me, because I just talked to her through this, and she did this pretty quickly. And I'll just show you. Sorry about the soldier if that upsets anybody, but this is usually a military talk. So if this is the wall that people face, the anatomical, physiological, or psychological barrier that prevents them from getting to the goal, right? What can they do to change that, right? One is they can have perspective. And what does that mean realistically? Is perspective is stepping away from the issue that you have right here and taking a deep breath and looking at yourself with interest rather than with horror or disdain or anger or fear, and saying, well, that's interesting. It's like looking at your bodily symptoms. And in family medicine, God love you guys, because you have all this hay to sort through before you find the needle in the haystack, right? And I'm not sure there's that many more needles in there everywhere, but there's sure a lot more hay, it seems, right? And that's what's making it challenging, right? But taking a step back for that patient and say, okay, what do you really think is going on in your body? Live with that pain for a while and see what it's trying to tell you. So perspective is one thing, and we'll talk about how to do that. Meditation is a big piece that can give you perspective. So that's one way to reach the target. The other thing is to raise the goal. And I'll show you multiple examples where that's the case. So anybody give me an example where raising the goal has actually healed an underlying condition. And I'm putting on the spot here. So anybody had Achilles tendinosis here? So Alfredson, not the Alfredson team captain from the Senators, but Alfredson was a Swedish orthopedic surgeon who had an Achilles tendinosis, and it was chronic. And he was sick and tired of it, and he wanted his colleagues to operate on it. But as you know, you don't operate on a degenerative tendon until it ruptures. So he said, well, I guess I'll have to rupture it then to get operated. So what did he do? He got off the side of his step and kept loading more and more weights and ramming his heel in eccentric contractions to try to rupture his heel cord, right? So guess what happened? He got better. He went through the pain, pushed through the pain. I'm not saying doing this every day. He pushed through the pain, and that's now a known treatment for tendinoses, is you load a painful tendon eccentrically, right, until you think it's going to snap. And it heals, right? But what do? More anti-inflammatories. You know, rest that. Why don't you just not run so much anymore? Now, running is a concentric activity, so yeah, probably you shouldn't run, but doing heel dips. When I was a resident not that long ago, I graduated from Ottawa in '96 from the physiatry program. We used to just rehab people by teaching them to use their non-affected hand after a stroke, right? How crazy is that after what we know about neuroplasticity? We've just completely annihilated any chance of the other hemisphere of ever recovering. So now we tie their hand behind their back and force them to use their plegic hand, as long as they have some function. And lo and behold, 20 years out, you can still teach someone to feed themselves with their plegic hand. Who would ever thought that, right? But that would have seemed inhumane at the time. I've seen people with huge disc herniations that we've done epidural on, put them on the table, they've marched 40 kilometers, 4 days straight, came back, we did a CT scan, there was a huge sequestered disc. They called me up, said, this guy's got to see a surgeon right away. I said, well, he's just marched 160K, right? So if we can control the pain, set the bar high, in many cases we can actually overcome the limitations that we have. So, yes?
So, I kind of see that a little bit. I think of examples, maybe that's where I screwed it up a little bit, where I just had somebody, let's say, struggling on a hospital service, based on the weight of the people that they have to, there's a lot of admissions, and I can see that, but I also see this tension with not overloading themselves, because sometimes if they're not making it over the wall and they can't see, and really just they start to get a little bit of I can't do it. But
absolutely. No, then thanks for pointing that out. I mean, it is incremental. I mean, you don't just suddenly load it, because he probably would have snapped it if he didn't do it. Plus his pain would have limited him from doing that. So I think at some point, judging the pain. So are you uncomfortable in the situation? Are you generally suffering? And I'll show you the definition of suffering later on. But again, it's not so much taking the load off, I think, but shifting their perception of what that load means. Is it because they feel every patient has to be dealt with in a perfect fashion? Is it their perfectionistic tendencies that mean I can't go to sleep until I've checked every lab and made sure everything? Sometimes, I hate to say it, good enough is good enough, and 80%.
Well, I think that's sometimes where we failed them, where we've actually said, well, let's take you out of the environment, so try to give them perspective and distance, and all they've learned is that's, if they go back in there, I'm just going to be just as, I'm going to attack it in the same way.
Yeah.
That's the problem. They need to change how they think.
Exactly. I mean, most of how many of you have been off more than 3 days from work in a row? Probably not often for injury or illness. How hard is it to get back in the groove after just 3 days, let alone 3 weeks, 3 months? We know all the return to work stats. You guys know them better than I do, right? 6 months, you got a 50% chance. 1 year, 25% chance. 2 years, it's almost 0% chance returning to work. So returning to work in whatever capacity is absolutely essential. Now, I know you're not the one signing the sick chits for your residents when they come in and say, I went to the clinic. But maybe there can be a discussion. In the military, we have that privilege that we can call up the commanders. They can call us up and say, look, we think for this person's best interest, not necessarily for the organization's best interest, we think it would be best for them from all perspectives to reintegrate them sooner rather than later, because once you lose them out of that fold, you're not doing them any favor, right? And having that discussion right from the get-go, like any sick leave should be accompanied by a return to work program right off the get-go, because that's only deferring the inevitable. Yeah.
Sorry to interrupt.
No worries, yeah.
My point is that I agree with all that. I've had some very bad skin injuries and I recovered without even a physiotherapist. But I see my patients that it's a personality.
Yeah.
So it's not only the injury, but it's who has that injury.
Absolutely. And no, thank you for pointing that. And this is utopian. That's why I said I feel like a bit of a hypocrite, because this is nice in theory. In practice, try to convince someone with a borderline personality disorder whose whole purpose in life is to make you fail, right? I mean, who gets under our skin more than a person with borderline personality disorder? That's their definition, right? 2006, Afghanistan, he took his helmet off in reverence for the elders in one of those tribal settings, and an axe was dropped on his head and split his skull open, basically amputating one of his hemispheres. And so he was told, his wife was told, Donna here, was that he'd basically never walk and talk again, and that she should just find a long-term care facility. Lo and behold, he got sent to Ponoka, Alberta, one of the few rehab centers that does long-term intensive TBI rehab, and he's now father to child. He's walking, talking, and he's planning to go to the Invictus Games in 2019. So if somebody with an axe blow to the head with basically a hemispherectomy can recover to that extent, now he had a lot of personal factors and environmental factors that were conducive to that. My argument is that we can do almost anything, right? And that neuroplasticity is the next frontier, that we can rehab anything. Now you guys will recognize this as an elbow joint or former elbow joint, but that's got to hurt, right? So then the orthopedic surgeons tried to do this, and that didn't work out too well. But what if I told you this is the same guy on the right? Right? And he lost his leg in that same blast. And this is the same guy building his house. He has no elbow joint. He does this weird stuff with his elbow. I said, stop doing that. You're going to stress your ulnar nerve. And he does these party tricks with his elbow joint. He does everything every other soldier needs to do. And even went up to the North Pole with him on this sled that we concocted over a weekend up in the Gatineau Hills. And this is the teddy bear that his daughter gave him when he came back. So again, he had a why. And this is the biggest thing I'm going to leave you with later on. If you have a why, you can get through almost any how, and I'm going to repeat that. It's the why in life that I think seems to be missing, and I'll repeat it over and over again. Corporal LaRocque, who lost his leg 1 year out, was on the Canadian sledge hockey team. This is Master Corporal Franklin, who lost both legs, and our former defense minister. He started a fund, Master Corporal Franklin, which benefits all amputees now in Alberta. And so out of this carnage came some good news stories. And regrettably, and I'm not preaching for the parish, but regrettably the media doesn't pick up many of these good news stories. He wrote a book about the long walk home. It was 1 mile to walk his son to his first day of school in grade 1, and we got him these $50,000 a piece prosthetics. Now they're more like $100,000 a piece, and I don't think any Canadian taxpayer would have flinched at letting this gentleman walk his son to school. Sergeant Brett Ricard, who was just at the Army Run this weekend, 30 years ago he lost his leg in a winch cable accident in Petawawa. On the day after his son died in a car crash, he ran the run with his son's picture on the back. Master Corporal Jody Minnick, a city councillor in Ottawa, who's I think now going to change jobs with his daughter and 2 other of our patients. Christian Miranda, Captain Christian Miranda, who's had reconstruction to both legs, basically just short of an amputation to both legs. And Dale Cross, Corporal Dale Cross from Brockville, who's done the Nijmegen marches. This is the 160K 4-day march that I was talking about. So these are examples of resiliency. Yes, they're physical injuries, but I can tell you for a fact they all have some degree of psychological injury as well. And so yes, these are select people. I have a huge privilege of working with these people. For every one of these, there's at least 10 others that you described. So don't think for a second that all military folks are built like this. So again, another example of resiliency. What would you think if this person came to your office? There you go. Not a great place to start, but any idea who that is? Eleanor Roosevelt. Right? So even out of a terrible childhood, and it's been well described, not every adverse childhood event, although you'll hear me say it more often than not, adverse childhood events are probably the biggest public health crisis that we are facing by far. And if you haven't read Bessel van der Kolk's book, The Body Keeps the Score, I compel you to read that book, because in family medicine especially, has anyone read it, by the way? Bessel van der Kolk, The Body Keeps the Score. And that'll give you every explanation you ever need to know. Plus you can give it to patients and they'll understand, because I was flabbergasted when I got into practice, the numbers of people that have had some kind of abuse. And we don't have to go there, but if you start asking that question and you start digging in that territory, I guarantee you your outcomes with patients are potentially going to change around. So, but not every adverse childhood event leads necessarily to poor outcomes. If you've got good role models in your life, you can turn that out to a strength, right? So everybody knows who this is, right? That's got to hurt. That's got to hurt. And if you see the footage from when he took his leg off at the end of the day, it was like hamburger meat. I mean, this was day in, day out, a marathon a day, all the way to Thunder Bay. And I remember those 2 summers, 1980, 81, I was just starting university. And when you look at his leg now, which is at the war amps here in Ottawa, compared to the ones I showed you before, this is leather straps and wood. And basically he had to do that hop, skip, and a jump thing because it wouldn't come through. Now guys are running, you've seen in the Paralympics, and you've seen Oscar Pistorius. I mean, they had to see whether he could compete with the able-bodied because he was thought to have an advantage because of his blades. So that's got to hurt. Anybody read this book? What can you tell me? What was your take home from that?
Well, he's a physician, so it's very interesting, but this man has gone through, I don't know, the worst. I mean, he was in a concentration camp.
Exactly.
The things he saw and experienced. But the actual book doesn't, I mean, it gives you an idea of
Yes.
what he suffered, but it's more, he talks specifically about how different people are interpreting different events.
Exactly.
And to me, the biggest part was the fact that he was able to see good in almost everybody.
Mm-hmm.
And even the worst abusers, he managed, and he said, when I lose that ability
Yes.
to see something positive, then the hatred grows in me and then I will fall apart. So
Brilliant.
that's how he-
Awesome summary. Thank you for summarizing. I thought this was a brilliant read, and
There's
that.
an audio book to do it.
Oh, fantastic. Good. Well, definitely one that is, once in your life you have to have read this book, right? And he was a psychiatrist from Vienna. He was Jewish. His mother and father were getting on in age. He could have fled Vienna. He didn't. He got brought to concentration camps. Mom and dad died. I think his wife died. He lost a child. Like as much carnage as you could possibly imagine a human could take, right? And despite that, he did not lose his humanity. And he was working on a manuscript before he even was incarcerated. And his biggest painful event was that they took the manuscript away from him. So he had a why to live. He was going to write that book when he got out. So when man has a why, he can get through any how, right? And again, it's the why that counts. So what he said in there is you can take everything away from a man, and God knows, and this is man obviously meant in both senses, except his freedom to choose how to react in any situation. So how many of you sometimes feel, my God, that patient is really pissing me off, or this resident is really getting under my skin? But are they really? It took me a divorce to figure out that, you know what, we do it to ourselves. And if you need some tricks to figure out how to cut yourself from that addiction, because we do have a pervasive addiction to shooting up on this shit, to be honest. And I left a bunch of syringes at the physiatry clinic. We got tons of syringes, right? So leave a bunch of syringes, empty ones, dispose of the needles around your house, to realize that any kind of negative thought patterns that are recurrent in your mind, they're all self-induced. No one's putting them in there. You're shooting up on this stuff. And your brain can get addicted to this as much as any positive thought. You just have to turn the switch and decide what it is. 6 weeks for a habit. So commit to something today for 6 weeks and do it regularly, and it'll be a habit. And start with something small. But certainly if you need a reminder, some people have a little elastic band and they'll snap themselves when they're getting to those thought patterns. Anybody see this movie? If you can turn a concentration camp into a game, now it's just a movie, it's Hollywood, I agree. But I think that was the best metaphor of just change the way you look at things, and the things you look at change, right? I was going to put on the final scene, but most of you remember the kid basically says, we won, and he gets to ride out just like his dad promised, right? So how much of the pain, and this is physical pain, but it could be psychological pain as well, you're experiencing is inherent in the sensation, and how much is your reaction to the sensation? And this is the stepping away from the wall I was talking about. When you have patients that are just stuck against their pain, and you know what they look like, right? I don't have to tell you what those patients look like. They are identifying with their illness, and they come with all these reams of information from the internet to corroborate what their perception of that illness is. Because to step back and see the real cause of their suffering would be just too bloody painful. So it's easier to stay stuck in that metaphor of I have fibromyalgia, and I use that as an example because a lot of these patients do, or I have, whatever condition, than to confront the true demons that are hiding in your closet ready to come out. So this is again what I learned through the course of my divorce, is that suffering and pain are two very different things, right? So, and this is why we get frustrated as clinicians. And especially as somebody who tries to treat pain, if you talk to the people at the pain clinic just across the road here at the Ottawa General Hospital, they'll tell you that in any pain clinic, academic center or otherwise in Canada, we have a 10 to 15% chance of reducing your pain by 50%. So 50% is considered a success. So if you go from an 8 to a 4, that's success, as you know. For the patient, that's often not considered successful, but that's what we aim for. We achieve that in 10 to 15% of cases in academic pain centers. So why is that? I mean, one big reason is that patients are presenting with undifferentiated suffering. And if you can ask yourself the question, am I in pain or am I suffering, right? Because there's a big difference. Because pain can be dealt with to some degree with medications, physiotherapy, physical measures, all kinds, but our hit rates are pretty low. But acceptance and forgiveness, this is where the money is. So accepting situations that you cannot change for what they are, and stop fighting to change things that you cannot change. If the CEO has just put out a directive in your hospital that you don't agree with, well, you can sit on the board and try to change it, or you can say, and without resignation, patients often tell me, well, I might as well just resign myself to the fact that I'm going to have chronic pain for this. No, you can still persevere in trying to make it better, but accepting is the things that you can do on those fronts that you can't change, and the forgiveness. We'll talk a lot about that later, because this is where you see the real magic happen. Anybody read the book of Forgiving by Desmond Tutu and his daughter? Another really good book. One to hand your patients that are stuck in that anger and that are resentful of the recommendations you might be making to try to get them out of that stuck phase. So Desmond Tutu, as you know, with Nelson Mandela, averted the biggest bloodbath in South Africa that you could possibly imagine. And how did they do that? Through the Truth and Reconciliation Commission, by getting the perpetrators and the victims face to face, and finally cutting through the crap and saying, look, you put a tire around my husband's or my son's neck, and you burnt him to death, you know. And again, it does not mean that we're condoning what the other one has done, but it's absolutely critical for people to minimize their suffering. So pain in life is inevitable, suffering is optional, and it's up to you to decide. So part 3, an action plan. So how do I cultivate resiliency? So as I mentioned, trauma in medicine, as in all facets of life, is probably a fact. I would defy anybody who's been in practice for more than a couple of years to say that there was not at least one thing that traumatized you. Now, whether you developed, post-traumatic stress disorder from that, I've had a few colleagues in my own class that have, from very traumatic events. So it happens, and we know physicians actually per capita have some of the highest suicide rates around. And so you can grow through trauma, and given that what we see and live through either vicariously or directly, you could get a sense of increased inner strength and openness to new possibilities, closer and often deeper relationship with friends and family, and I'd say even your colleagues, if you're willing to open up to them and give them some insight as to what's going on, and enhanced appreciation for life and a stronger sense of spirituality. And I think from my perspective, this is where often things are lacking. I had the great privilege of seeing some of the fighter pilots. Anybody seen the Hanoi Hilton here, the movie? So these were the fighter pilots who were shot down over North Vietnam in 1962, and some were freed in 1975. So 13 years as POWs. And I asked them, what kept you going all that time? And 2 things. 1, I knew my family would still be there when I got back. And 2, I had a belief in some higher power, right? Something that kept me going. And I think if we look at what's been eroded in our society overall, it's those two pillars, right? Families are eroding generally, and although there seems to be recrudescence for spirituality, I think that may be coming along as well. So if you read through this, for a seed to achieve its greatest expression, it must come completely undone. The shell cracks, its insides come out, and everything changes. To someone who doesn't understand growth, it would look like complete destruction, right? So to your point, Eric, I think we don't want to destroy our residents, but we don't want to shelter them unnecessarily, right? If they're going through a painful phase, let's accompany them through that phase at our side, not while they're at home, but trying to accompany them, saying that this is just like growing pains in our children, part of the process. So John Kabat-Zinn, as you know, was the father of mindfulness in North America, at least, said, you can't stop the waves, but you can learn to surf, right? And you've probably seen the movie of the surfer that lost her arm to a shark attack. You can adapt even at high-level sports like that. But you do need a surfboard to be able to surf, right? And sometimes, no matter what good teacher you have, the waves are just too high, right? And you also have to know what you're getting yourself into, because no matter how courageous you are, you may not have adapted yet to achieve that. So in terms of determinants of health, you all know this better than most, right? But we know that the healthcare system, and this is what patients don't often understand, is only responsible for at best a quarter of your health, right? The rest are societal, genetic, and environmental factors, right? But look what's 2 on the list here, even without my glasses. So adverse childhood events again. this is where I think a lot of people have to work. And we might say, well, people getting in medical school, they don't have adverse childhood events, right? If you want to read a good book on that, When the Body Says No, Gabor Mate. Anybody know Gabor Mate? Yeah. What do you think of Gabor Mate? Some people hate him, some people love him. Yes. I know, I can tell you're sort of lukewarm. I wish I would have had that book in medical school, because I think he cuts to the chase to a lot of things. Now, like anybody, we can get overzealous in any area. But he says he deals with the addicts on the east side of Vancouver. And of the female addicts, 100% have been sexually abused. 100%. Right? So my take on addiction medicine has changed drastically from when I was an arrogant young physician thinking, oh, if you just got a grip on your life, right? Or if you're just more disciplined, you could get a grip on that. Well, addictions don't just happen willy-nilly. We don't have an opioid crisis necessarily in Canada as much as we have a suffering crisis that people are trying to mitigate through opioids that they happen to get their hands on. So if we know that, and sometimes you have patients that say, I have a perfect childhood. That's a warning bell in itself, because who had a perfect childhood? Thank you. Who had a perfect childhood? And when you say that, it means you've suppressed normal human emotion, which we'll talk about, which is anger. And God knows there must be patients that make you angry some days, right? Unless you're not human. But some of them get under your skin like there's no tomorrow, right? So if you do not have a place to vent in a healthy way that anger, and even have a dialogue with that patient, that anger is literally going to kill you. And there's some crazy evidence that people with ALS, who's known a patient with ALS? Have you ever met an angry patient with ALS? They're all really nice people. And that's been studied. They are wonderfully nice people. There's articles published on that in the EMG literature, because the EMG guys are the ones that make the final diagnosis. They are nice people. So again, be careful what you're thinking. Your cells are listening. If you say, I'm fine, I'm fine, I'm fine, bring it on, I can do more. Bullshit. Call a spade, I'm not fine, right? And you're making me really angry right now. So can we talk about this, right? Because this sort of, I'm holier than thou, and as a physician I never get upset, and I have to have decorum and be professional at all times. Well, I think that's BS personally. And why would we be any different than every other human on the planet? So, evolution. Obviously, we talked a lot about internet, cell phones. I mean, it's rampant right now, right? But I think we're being overtaken by evolution, and yet sometimes there are simple answers that are waiting for us that we're not applying. So as I said before, when you leave here today, start where you are, use what you have, and do what you can. Don't fight the big fights, because we know where that leads to. This was out of one of the schools in Nepal, actually. I like this in the corner. Nothing is impossible, right? This was a Sir Edmund Hillary's school that he formed way back in the 1950s. And a cute letter to the teacher, why I'm sick today with a fever. Anybody recognize this? It's a concha shell, right? So what are these different compartments? That's just like our kids. When they grow out of one room, they move into the next, right? And they're basically growing until they grow themselves out of the shell, right? And that's basically what we should be looking at. We've got to continuously expand the walls that are constraining us. And that's often more of a limitation than the stresses that we're under. Is the perception, again, that we have is maybe because those walls that we set are getting too tight. And it might be important to widen them a bit. So listening to your inner voice. And this is something that came to me one day while I was listening to a patient with fibromyalgia. Because if you tell them, and they'll look, you say, that's it, doc. My body is screaming at me, right? And they're often nice people too. They're sort of almost borderline nice, because they come across as very affable, and yet they've had terrible things happen to them often. So I said, look, your soul was whispering to you a long time ago, right? And you were kind of suppressing, you weren't listening, and now your body is screaming at you. So it's time you listen to your soul. But how do you do that, right? How do you get connected with your soul? Again, when the body screams, right? The biggest problem, and I've heard somebody say recently, when we started dividing mental health and physical health, in the military we still have mental health clinics, and they're on a different floor from the physical health clinic. And then when religion took over the soul, right, and there was actually meetings apparently amongst the clergy, the physicians, and the psychiatrists as it were at the time, to divide up these partitions. But whoever said that we can nicely divide the body up into a mind, a body, and a soul? I mean, we see it all the time, and in family medicine you see that clearly. Many injuries are at the level of the soul. And if you don't get to that root cause, there's no pill or surgery that's going to cure that, right? So how do you connect with your soul? For me, and I gave that to one of our guys who's really stone-faced. He was just angry, big arms, tattooed, and he was just bloody angry. And I said, when's the last time you cried? You know, I said, well, when my sons were born. I said, so his sons are now enrolling in the military, and he's concerned because they're going to be sent off somewhere that might see bad things that he's seen, right? And I said, look, what if I told you that that little unfettered soul that you held, right, is you, and it's still there, right? And it's never going to change, because your soul starts from the time you're conceived, depending on when you think your soul starts, until the day you die, and then it goes into another form, whatever you believe in. I don't want to convince you of anything that you're not convinced of, but it's unchanging. All those layers of crap that life throws at you, it's not changing, right? And so you got to connect with that inner child, right? You got to call for help to your buddies, right? And be that inner child. What did you enjoy doing when you were a kid? What turned your crank, and how far have you strayed from the path that you used to be on, and that you've now become from that emotional straitjacket that life has twisted around you? So this is another book. I know I'm giving you lots of books. Tribe, Sebastian Junger. He's a veteran from the American military, came back. Quick synopsis of the book: 1 million American troops deployed to Iraq and Afghanistan, 100,000 saw active combat, 500,000 are claiming PTSD benefits, so a 400,000 delta. Where are they coming from? So his premise is, when you're under fire, literally, and that's what may have changed when people, who was saying before, when we used to do call all the time and people were working, they were tired, but they weren't depressed. I mean, when you're under fire and you're working as a team and everybody's, you know, putting in their hours, there's not much time to be depressed, plus you're all in this together. Well, society has kind of become me too, not to paraphrase that, but all about me, right? How do I get ahead? How do I stay ahead? What's good for me? And that these soldiers that come back are missing that tribe. So if we want to cultivate a sense of unison in the medical profession, I think we need to get this sense of tribe back, right? And get those kind of cultures back where people are literally facing those things together. So being an expert companion doesn't require any kind of medical degree. And in fact, when you look at the statistics for 9/11, only about 10% of people consulted mental health professionals. The rest either saw acupuncturists, massage therapists, spiritual healings, or faith healers, right? So it doesn't require medicine to necessarily heal these wounds, but it does require somebody who's going to stand by your side. And so what does trauma do? It confronts us with the questioning of deeply held core beliefs and values. And this is where we get to that point, that uncomfortable area to say, well, I was raised with this, and this is right, this is wrong. And I'm not saying none of that was right or wrong. I'm just saying, who tells you that that paradigm is still working for you right now? And if it's not, maybe it's the constraint, that emotional straitjacket that you're in, that is actually causing you to suffer so much in the face of something that you might see through a different light. And we know that from the literature, because a lot of our guys did go on to do some amazing stuff, but you have to go through a grieving period after you've incurred a loss, and they call it deep rumination, where you're ruminating deeply about what happened. So that's why meditation is so important. That's how, in my opinion, you can connect with your soul and that inner voice that's whispering to you. And Jon Kabat-Zinn, as you know, has done all that work in North America on mindfulness. The other thing that's critical, yes? Yeah.
I wonder sometimes with learners, whether it's just confronting that vision of yourself as being a little bit different. Like I was thinking of the last talk, where there was that doctor who had this sort of sense of perfection, always in the top of their class.
Yes.
Sort of realizing that we're not.
Exactly.
We make mistakes. It's, sometimes that deep rumination can just come from the fact that we're not.
Absolutely. Yeah. Perfect commentary. I couldn't agree more, is that your paradigm is not working for you right now. I'm not saying, to slack off, right? If you're a neurosurgeon, you've got to clip an aneurysm. I mean, sometimes it's not good enough. And the surgeon needs to say, you're like 1/10 of a millimeter off, and go to the right or left of that. So there are times where perfectionism does pay dividends, and I'd want my neurosurgeon to know, exactly when he's clipping that aneurysm, that he's on the right spot. But let's face it, most bobos today, hate to use that term, are not of that nature. Right? But that's a very good point, right? Change the paradigm that you're looking through, without then flipping the switch all the way to the other side, where people say, well, what's the point then? I might as well not even show up. No, that's the first rule I said before. You got to show up, right? You got to show up, no matter how shitty you're feeling that day. You got to show up. So imagination is more important than knowledge, right? And I'm sure you as family physicians often know you got to get creative at times because you don't know what to do anymore. The specialists keep firing them back at you. You've tried every new specialist on the block and nobody's figuring out what's going on here. And so imagination is key. In PTSD, there's a great talk where this psychiatrist has been practiced 50 years, says we don't need more psychiatrists and psychologists. We need more kindergarten teachers. This is from a psychiatrist. Why? What do kindergarten teachers do? Resilience. You must have read, was it Robert Fulham's book, Everything I Needed to Learn, I Learned in Kindergarten? Did you read that book? Yeah, there you go. Yeah. Resilience. So she's resilient? Yeah. Yeah. So she's, yes.
I think having a 4-year-old granddaughter, I love your kindergarten question.
Yeah.
So you've got a kid that started to have a meltdown or some kind of real problem, and then the first step is validating it and tuning the emotion.
Yes.
Then setting the limit,
Yeah.
saying this is possible, this isn't possible. And then the next step is saying what can we do about it?
Yes.
Which uses this imagination.
Yep, brilliant.
And for the 4-year-old, it's kind of cool because you can say, we can call Superman.
Yes.
And he's going to kill you.
Yeah.
Now you call him right now.
Yeah.
Oh, he's busy.
Yeah.
So we'll just walk a little further. I know you can't walk
Cool.
anymore. I want to carry you, but I can't because you're too heavy. But Superman's going to come anytime, so we'll just keep walking. And all of a sudden we're home, right? So it's the imagination part of it that does it. That does the.
I love it.
So those 3 steps can be very helpful when you're in a situation. First of all, calming down the emotion.
Yes.
Then limit setting, because the limits, you can't be washing all over the place.
No.
You can't break those limits. But then you can use the imagination, and often the kid comes up with the weirdest things, which if you say, yeah, that's a great idea.
Yes,
as long as we get where we want to go.
Exactly. No.
The patients come up with their own solutions, which can be really cool. Like they have imagination.
I agree.
You just give them a little bit of control.
And if they don't, you can cultivate that again through music, art therapy, equine therapy, all those things that do actually cultivate your imagination. And there's science out there to show that now. So I would have been embarrassed to hear this talk 30 years ago, to be honest. I would have said, who is this charlatan that's talking about kindergarten, drawing pictures, and why is adult coloring books such a popular thing, right? It finally focuses you down to doing one thing, deep work, and being immersed in the current task, right? Which is what kids do, right? When they're doing something, they're usually immersed in that task, right? So that's awesome examples. The other thing to recognize, I don't have to tell you guys, but it's all about the lizard in us. So we're essentially all lizard brains, right? And we have 5 primal instincts of fight, flight, feed, freeze, and another thing that starts with F. And your brain, essentially before anybody even opens their mouth, before I even started talking today, you'd already sized up and say, look, is this guy a threat? If I was talking to you like this, right? Or if I was talking to you like this, right? That would be a completely different scenario. Your brain is going to take those conclusions and run with them, right? So our subconscious minds are much, much faster at sizing up a situation. And I think that's critical to know, because if we don't respect the fact that it's the lizard in us, what do you make of a picture like this? Is that a good or a bad image? It could be either, yeah. Why?
Well, it might be tears of happiness and accomplishment after a really difficult thing.
Yeah.
Or it could be sadness out of loss.
Yes.
Or failure.
Yeah. Brilliant. Either way, it's good, right? Because he's releasing normal human emotion to an abnormal or potentially abnormal situation, right? So this is where I get back to allowing ourselves, just like the kids in kindergarten, to release normal human emotion at the appropriate time within reason. Because the only animals that don't do that, I know I realized recently, you've probably seen all those films from Africa where the zebras get attacked by the lion. Apparently a lot of zebras have got swipe marks up their backsides from the lions that knocked them out, and they just barely managed to hang on, right? Well, what do the zebras do? Or who has a dog here in the room? What does your dog do when it gets spooked? It what, sorry? Yeah, that too. Yeah, it shakes it off, right? So it probably goes through a period of hyperventilation and shaking things off, right? So the only 2 species that don't do that is humans and zoo animals, right? Which again tells you a lot about the cages that we're putting ourselves in. So I would defy you next time you have a traumatic episode, whether it's a near miss on the road, hopefully not, that when you have that compelling urge to shake it off and hyperventilate, For God's sake, do it, right? Do it until your hands get tingly or you get tetanus in your hand. Tetany in your hand. I've done it, and believe it or not, it is the most phenomenal, liberating experience you could possibly do. But what do? We give people Ativan instead, right? Or say, stop breathing so much, or here's a paper bag, right? I mean, the paper bag's fine, but so you have to release emotion when it's time, right? Fake it until you make it. There's all kinds of literature out there that if you fake a smile, and Darwin said it many years ago, we're not smiling because we're happy because we smile. It really freaks them out, right? They're wondering, what do you want from me? Or what's wrong with you? Right? Just try, in the headquarters, especially military headquarters, it's pretty hilarious because all these guys are dead serious, right? So you start smiling at them and they think something weird's going on. So this is a book, again, when the body says no. The one I want to stick on is the anger, all right? This is a healthy emotion to release, not a healthy emotion to store. If patients are making you angry on a regular basis, either change your view of that patient, or if it's inevitable, first of all, they're not making you angry, you're making yourself angry, but you do have to release that anger because this is going to make you sick otherwise. This is the question I get all the time. Why do bad things happen to good people? And I haven't got a perfect answer to that, but this is where the spirituality piece comes in. And anybody read The Power of Now by Eckhart Tolle? It's a hard read, right? But I thought, you are where you need to be right now, full stop. You are where you need to be right now, full stop. And the universe is unfolding as it should. So all these questions, would have, should have, could have. If I hadn't done that, I wouldn't have been in a car accident. If I hadn't missed that little lab report that day, this patient wouldn't have stage 4 cancer right now. If only, it's endless. In our professions, it's endless, the stuff you could chastise yourself for. Stop. Do your best every day, whatever you bring to the table, but stop chastising yourself for stuff that happened in the past. I can leave you a copy with this, but essentially what this is saying is things are happening to you for a reason, right? If you want to read that very quickly, because I do think it's important that you take that home. So that's the best explanation I've read so far as to why bad things happen to good people. Perfect, that's perfect. And again, this is basically out of the chronic pain literature, but patients often coming in looking for a physical explanation for their pain that's often mediated elsewhere. And they want the scans, the MRIs. You guys are the gatekeepers of that. You know exactly what that means. So your body and any scans reflect your life story, not necessarily injury or pain. So rather than saying, here we go again, how often you got yourself doing that? Here we go again, this patient went. How about here we grow again? Right? Because each one of those defeatist moments can actually be a call to action that you're being called to achieve that next higher level of spiritual development, or whatever you want to call it. This is a photograph a patient of mine shared with me actually, which says it all. So out of carnage can grow beauty, and not only that, it happens to be a poppy. And even the poppy now with the opioid crisis, as you know, we've gone from one pendular swing to the other, right? And now there are a lot of doctors, I'm not touching opioids. That's it. We messed up big time. Well, we're doing a lot of patients a disservice by taking that extreme view when the middle ground is probably the way we should be going. So why, when you ask yourself, why me, right? Why me, why now, why this? And we get this all the time from our patients. Why not ask, what do I want instead? What is it that I want out of life? What's my why for existing? Why is it important to me? Why don't I have it already? How do I start, and when do I start? And my answer to that would be today, right? Whatever you list today as your one thing that you're going to start on, please start. And some parting thoughts. This is Sir Edmund Hillary's son, Peter Hillary, and the example I'll give you is this Adam of Blam, which is one of the highest peaks next to Everest, and he was climbing there back in the 70s, and there were 3 days up the mountain on 2 rope teams, both tied to each other. And all of a sudden, these refrigerator and freezer-sized chunks of ice started coming off, right? So he got hit by one, passed out. When he came to, he thought, wow, it feels really heavy. And what had happened is the one team's rope had come across his waist, basically, and he was holding 2 guys. And the only guy holding them all up was the one guy who was anchored at the top. How that was possible, I don't know. And his arm was broken, a compound comminuted fracture sticking through his coat. And so they're hanging there thousands of meters above, right? And they look down, so the left guy is dead. Clearly he's been hit too hard. And tells the right guy to anchor down and cuts the rope, right? This guy's got to fall, and the other guy comes down, and this gentleman comes up, sticks his arm in the coat, and says, we got to go down, right? And then you ask him, like, how did you manage? Like, talk about resiliency, right? And he didn't seem traumatized by that. He said, well, what choice did we have, right? What choice did we have? Now, mountaineering is maybe not the same thing as life. Sometimes we don't have choices. But what choice do we have but to persevere and to keep going? So the road to mental readiness, SMART goals, you've probably heard this, is the first thing. Your why in life is the S, right? Get yourself some SMART goals. Visualization, the imagination piece, where do you want to be? Tactical breathing, meditation, all those things you probably learned. There's articles that tell you that everything I've told you basically is BS unless you put it into action. All this nice gobbledygook is only gobbledygook at the end of the day unless you take one thing from this and put it into action, right? So simple motherhood statements: go outside and play and eat your vegetables. You don't need to know about diet. You counsel your patients all the time. These are my nice, simple little, I like things very simple, recommendations. So one of our soldiers who lost his leg and was the team captain for Invictus last year in Toronto. Forgive all people, everything, always. And this is where I get recoil often, because there are some things that may be truly unforgivable. But know that true forgiveness is when you realize that there was nothing to forgive in the first place, right? And that starts with yourself. Forgiving is also forgiving me emotional freedom. You are releasing yourself from the clutches of the thing that's holding you back, right? So, summary recommendations, the 4 great truths. Do your best, whatever your best is for that day. If you're feeling shitty, you can tell people, I'm not at my best today, but it is what it is. Speak your truth. Let's not sugarcoat things. Don't make any assumptions, and don't take anything personally. Key elements to happiness. My son came back from grade 9 with this. The teacher said, if you do this till Christmas, you'll be happy. And it seemed to make sense to me. Meditate every day, be mindful, whatever that works for you. Exercise, keep a journal. This is critical. There's a lot of evidence now that writing things down, for no other reason than writing them down, is actually very therapeutic. Be thankful and show gratitude. We have a privilege to be in this country and have the jobs that we have, despite the fact that it's not getting easier. Do good to others, as your profession is compelling you to do. Get back in the game, do all those wonderful things we talked about of imagining a better future for yourself. Do all these things, and don't dig around the dirt too much. And what we tell our guys, don't talk so much about the war porn, they call it, these war stories that we all have, right? That near miss, the patient, just stop. Who knows if it ever went down that way? All right, and that's it. To err is human. You're not in control. And that's the biggest liberation you could ever imagine, is that we do our best, but we're not in control ultimately. Good judgment comes from experience. Experience comes from bad judgment. And that's what I'll leave you with.